Hi everyone, my name is Taylor Dana Miller. This is my third semester in the CRM program. I am currently a clinical research associate, also known as a CRA for a global CRO, which is based out of Research Triangle here in North Carolina. Clinical trials involve a great deal of a lot of different things, such as documentation, analysis, observation, and even organization. That's precisely what my role as a CRA is. I basically act as a liaison between the sponsor and the clinics where the study takes place. I was really excited whenever I learned that Wake Forest had a master's program for clinical research management. Clinical research was not really something that I ever saw myself being interested in, and it sort of just fell into my lap as I worked my way through undergrad and into the professional world. But I'm really excited for this program to encourage me to become innovative and allow me to develop skills to lead clinical research endeavors, and not only enhance my knowledge of drug and medical device development, but also in clinical trial conduct and monitoring, which is what I'm currently doing now. There are so many different moving parts when it comes to clinical research. Whenever I first started out in clinical research, I was a study coordinator, and then I later shifted into project management before moving on as a CRA. So I learned very quickly what research ethics was when conducting visits and obtaining informed consent. My time spent as a study coordinator and as a project manager taught me a lot about research ethics and conducting research that has value and validity. My scope of research has been mainly conducted on human subjects, so I've learned a great deal about human subjects protection, including minimizing risk and harm and maximizing benefits, respecting human dignity and privacy as well as autonomy. I've also learned to take special precautions when it comes to vulnerable populations. For instance, throughout most of my research career, I have worked with elderly individuals, most of those living with cognitive impairment. So building that honesty and trust and respect with that population is very important to me. And now that I'm a CRA, that hasn't stopped at all. I continue to follow good clinical practice guidelines throughout my career in research in order to protect patient volunteers as well as to preserve the integrity of the science. Being a part of a CRO is a large step out of the direct patient contact that I used to have as a study coordinator and project manager. I definitely miss it. I miss being around my participants all day, every day. But following good clinical practice guidelines is still just as important for me as a CRA as it was whenever I was a study coordinator. So that's just a little bit about me and my experiences in clinical research. I look forward to this class and learning more about research ethics.